Hello, Bell's Palsy here and member of the Bell's Palsy Solution, as well as people on the internet and anyone dealing with facial palsy. Today, I wanted to make a fairly quick video on, I guess you could see this as a public service announcement, since I get this question quite often via messaging or directly on the Bell's Palsy Solution Facebook group. How I've been asked, like, how do you discern a good physical therapist that can help me with facial palsy versus any other one? And a facial specialty trained therapist, which by the way could be a physical therapist, an occupational therapist, or speech therapist generally. One of the main thing that and you got to do your homework. When you're looking for care, you are likely going to be giving a call to a PT clinic and ask them if they treat this. And the fact is, this is not something very common for most therapists to treat. And I can tell you that the first time I treated a patient with facial palsy, with Bell's palsy, was after 15 years of being a physical therapist. And just treating this person one time obviously does not make you an expert at all whatsoever. This is the most likely scenario when you're going to go to see a physio. They are likely not going to know what to do. And you might have done more research than they have. You might have already gone on Google and tried to sort through things. And my inkling is that they are probably going to do the same. So they're not going to do much more than you. And I think one thing, if you're making an appointment with a physio like this, and are going to ask if they are trained in treating this, I would ask a few questions. I would ask personally to talk to that person, I think, and they at least owe you that if they want your business. But asking them about, do they know anything about synkinesis? Do they know anything about Ramsay-Hunt syndrome? About degrees of nerve injury of the facial nerve? Do they know that facial muscles are actually very different than other muscles in the body? All this kind of stuff could be kind of a way for you to eliminate a possible candidate to give them your business to get some help for facial therapy. Another one would be ask them if they know anything about the Sunnybrook facial grading scale. This is what us facial therapists use as the standard. And also if they know anything about the House-Brackman scale, which is the degree of nerve injury. That's the scale that is mostly used. And if they really cannot answer this, I would just avoid working with them. And you can always kindly ask if they know. For one, I know there's several governing bodies of facial therapists right now coming up with some listing of facial therapists for everywhere around the world. This is still being worked on. Whenever I have a link that is shareable, I will do so in the group as well. The one thing that demarks a facial therapist that is specialty trained would be what they do at what stage of your palsy. If they are big on teaching you exercise, which is what you're going to find online. Some exercise, which don't like that term because it makes you feel like you're trying to exercise your face, just like you're trying to exercise your arm or your leg when you're rehabilitating those limbs. And further could be from the truth, as you should not be doing this. The face is all about encouraging more movement by working on the soft tissue, mobility and the flexibility, And then once that you have that, and also some return of movement, you can then, with special cueing and special activities and very slow and controlled movement, retrain facial movement. Doing non-specific stretches and exaggerated facial movement, which is what you see a lot on the internet. This is not specific and should actually be avoided, as they show a lack of coordination, and they're not specific, and they will not be helpful and could actually create more problem by reinforcing mass movement pattern, where you're using your whole face because you can't move a specific muscle. So the way your brain's going to try to do this is just by engaging the whole face. So for example, if I lift my eyebrow and I don't have a lot, then I'm going to try to do this, and this is absolutely to be avoided. So the other thing that a specialty trained facial therapist should be doing is they should be able to explain to you the physiology of your facial paralysis, and discuss and explain some of the symptoms that are associated with it, such as dry mouth, over or under tear production of tears, the lack of taste, as well as the sensitivity with hearing, sensitivity to loud noises, called hyperacusis. Those are all things that should be ideally discussed on the first encounter with that specialty therapist. The degree of nerve injury should be discussed, and what kind of impact it might have on your recovery, and possibly developing synkinesis. A trained therapist should help you with proper eye care and teaching you how to tape your eyelid properly, and or other things that you can do to help encourage your eyelid to close. Also, how to tape your face for support when your cheek and your face are flaccid and you have no tone and there is no movement. I think especially early on, this is very important to spend a lot of time on education about all of this, the anatomy, the degree of nerve injury, also all the possible the complication, and what your journey with this might look like. So having all of this information early on is, I think, really key in helping you understand better, not panic, feeling better about the whole thing. I think a lot of people, the lack of information is flagrant, and people are very overwhelmed with this, with also conflicting information that they can get. But I think having all this information is key in avoiding making mistake in how you're going to rehabilitate your face, what kind of treatment you're going to go for, and what you're going to do. So for example, using electrical stimulation, which is a definite no-no, and any trained facial therapist or facial nerve specialist, if you ask surgeon and doctors that are trained in this, they will tell you they will not recommend doing some facial therapy with electrical stimulation. So I hope that was helpful and put things a little bit in perspective in regards to what you should look for. I think it's very important, and I think obviously the information is out there. It might be tough for a lot of people to reach it out and get it. The point of the Facebook group was to make this information available. And again, if you haven't, there is a ebook available for download. I go over a lot of this information in my online class. I do and teach that to new patients every week with facial palsy. That is from Bell's palsy or any other diagnosis after surgeries, and all that stuff. So yes, I hope this was helpful, and I hope you have a great week, and I will talk to you later. Bye bye.